Hi, welcome to RTH 223. It's a hybrid format for EKGs and ACLS. The setup of the class is going to be where the first 8 weeks will be EKGs. We're going to learn about them and be able to interpret them, and different arrhythmias, several of the ones that we will use during a code, and several other ones that you might just see when you're walking in and out of patients' rooms and in the ICU. As we go along, there will be a quiz or a test each week up until the midterm, and the midterm will be an accumulative for the EKG section. You will also have to do a competency on a 12-lead EKG. We're going to set it up on the mannequin in the back room of the respiratory lab, so each of you will have a competency set up for that. In the second 8 weeks, we're going to do ACLS, and there are 10 cases in ACLS. So the idea will be to learn what ACLS is, what the content is, and understand each of the cases and what they want to do. Because we're starting with the EKGs, we will then know the EKGs for ACLS, so that'll speed up that whole section, and we can use the EKG rhythms with each of the cases as needed. When we get to the end of the ACLS, we will have a regular final that will mostly be scenarios used in the ACLS setups, and you'll do a competency with me, which they call a mock code. When they do a mock code, it is usually set up so that you can go through each one of the 10 cases and in a scenario setup, and we'll do it with a mannequin, and I'll have each one of you perform it for me, and we'll practice when we get together. So due to the hybrid format, we'll do a lot of the EKG setups for the 12-lead EKG machine, and I have a EKG monitor so we can run some EKGs and look at them and help identify them while we're in classes. And same thing with ACLS. The days that we are face-to-face, we can go ahead and go through the mock system. We can look at the tubes we're going to use, how to set it up for the defibrillator monitor. We'll have one of those, and we'll learn how to do defibrillation and how to do the setup for conversion for the arrhythmias for tachycardia. So we'll have all those ready to go for you, and at the end, each one of you will do a separate competency for that. Okay, so the Blackboard setup is set up for the online course, and go ahead to the Blackboard site and use the Start Here tab, and then each of the homework assignments and the PowerPoints and write-ups that you need will be under each of the modules on the PowerPoints and on the setup of the course itself. So the Blackboard course is set up when you go in there as a start menu. There's a nice section for the syllabus, and it will tell you each week what we're going to do and what you will need to bring to class and what readings you'll need to be prepared for our in-class ones, as well as assignments and things you'll need to do for the hybrid class sections. All right, so it's nice to see you again, and I'll be looking forward to seeing you in our face-to-face class when it comes around. Thanks so much.